along with lifting and stuff. But like, and
Of
I
course.
told you beforehand, I'm about to do a 100-mile race in 2 weeks. That's kind of what I do for fun, and that's like you already know I'm freaking crazy. So like that's what I do. But really like so after I ran that 50 miles, I just started. We had access to Amboss for step
Mhm.
2. We didn't have access to UWorld yet, but I'm like I'm sitting here for a month. Let's just get started. And so my first rotation was OBGYN. I had done all the Amboss and redid all my wrongs before I even started in OBGYN. And then that first day I got access to UWorld. Um, and so the way I went about it, right? The minute you start your clinical rotations, your time is no longer yours. That first week of OBGYN, I was on like gyn-onc surgery. I was there like 12 hours a day and I was like, holy, this is like crazy. Like, how am I supposed to do this? And so that's really where I like threw away Anki. I'm like, Anki's not going to help me. So I like completely ditched it.
What's going on, guys? My name is Caleb. I'm a medical student in between my 3rd and 4th year doing a research year. And I've decided to devote a couple hours each week to sitting down with interesting people to hopefully pass along some knowledge that could help my fellow students across the country and maybe across the world. Whoa. And it feels very weird having a microphone and acting like I know anything about anything, but I assure you, I am just here to pick the brains of people that have actually done some pretty amazing things already. And a little bit about me. Back in my freshman year of college, I had no idea what I wanted to do. Medicine was not even on the radar. I didn't think I was smart enough. So I ironically listened to a lot of podcasts looking for some kind of guidance to see what I found interesting. And I landed on becoming a Navy SEAL because I listened to one too many of those podcasts. I said, Dad, I think I can literally become a Navy SEAL. I can swim, I can run. He said, I think that you should give it at least one more semester and then we can talk about that. So I said, all right, bet. And I figured out how to study, got some good grades, and decided just to put that special ops mindset into my undergraduate education. Got up at 5 in the morning, worked out, studied hard, went to the ER to work in the afternoon to get exposed, considering medicine possibly. I got exposed to some orthopedic surgery, and I said, well, I can either do ER or ortho. Like these are two very cool things, and I want to do this. So here I am trying to figure it out. But I'm not going to lie to you guys. When I got to medical school, I got distracted. Okay. I got distracted and I got overwhelmed by I had been coached up by my mentor. I did an interview with Dr. Nesbitt on how to deeply understand the concepts and learn for mastery, not just for good test scores. And the amount of information coming at me was just too much, I felt like, in the moment. And so that discipline and that focus definitely fell. But Adam Plotkin, my guest today, is one of the most interesting people I've ever talked to. He did not let that discipline and that focus fall to the wayside. Coming into medical school, he gets up at 3:30 in the morning, works out, maybe he does some jiu-jitsu, then he gets after it. And he ended up getting a 273 on his Step 2 exam. This is the most important exam for medical students right now because Step 1 is pass-fail. So if you want to be competitive, you've got to get that good Step 2 score. Interestingly enough, Adam wants to go into internal medicine, and all this effort he put into learning, he's not some naturally gifted brainiac that sits down for a couple hours each day and just spits it back out for an exam. He deeply understands these concepts because he wants to be the best IM physician that he can be. And I have a lot of respect for that. I also have a lot of respect for the fact that he tutors his fellow students for free. A lot of people get these great scores and then quickly hop on YouTube and, join my course, join my Discord, and, get this free PDF, and then they want you to buy their course. And he doesn't do that. And boards is always something I've struggled with. Standardized exams in general, I have struggled with. And so when I sat down to talk to him, I felt like we needed to hop online and have a conversation and share with everybody all the knowledge that he's been sharing with me. And so I hope that each and every one of you listening can get something out of this. I think pre-med students could get something out of this. But yeah, he's an interesting guy. He's training for a 100-mile ultramarathon right now. He is a power lifter. He's an HPSP student. So he just got done rotating for his 4th year audition rotations at all these military hospitals. There is so much that we touch on in this episode that I think you guys will really enjoy. Do not let the intensity scare you off. There are a lot of practical tips in here along the whole way from step 1 to step 2 to rotations. We talk about it all, and most importantly, we talk about a mindset for mastery. And I think it's intense, but it's a really good thing to consider for anyone stepping into this field. So I hope you guys enjoy the conversation. Thanks. All right, Adam Plotkin.
What's up?
How's it going, man?
I'm good. How are you?
Amazing. It's been a minute since we've seen each other.
Yep, been a little bit.
You've been pretty busy.
I have been DC and then San Antonio for my military rotations. But back in Milwaukee right now.
So that's home base for you is Milwaukee.
Yep, Wisconsin, born and raised.
Sweet, man. What were you doing at all these different places?
So yeah, I'm part of the HPSP program. So that's where it's a scholarship. The military, if you get selected for it, the military will end up paying for medical school. So like right now they're paying like $500,000+ for my 4-year tuition, and then they pay me. And then part of the requirement is your 4th year, you do rotations at certain military hospitals. So I was at Walter Reed in Washington D.C. or Bethesda area, and so that's the hospital actually that like the president goes to, congressmen, kind of all the big name individuals. And then I was also at Brooke Army Medical Center in San Antonio, which is kind of like the hub of Army medicine. So it's a level 1 trauma center. So saw very different things at both places. I did both internal medicine at both of them. So that was pretty cool. And like with this program as well, every now and then you have to do some other stuff for the military. So me being in the Army, in between my 1st and 2nd year, they sent me to Fort Sill, Oklahoma for 3 weeks, and then Fort Sam Houston back down in San Antonio for 3 weeks for like leadership courses and basic training. And that's actually where I met like your buddies, EB and Ritter. So they were some of my squad mates. And so that's kind of how we ended up meeting. But yeah.
Yeah, man. That's awesome. So internal medicine?
Yeah, internal med. Um, I don't know, people either love it or hate it. I'm one of those guys, like I could sit down for hours and think about like the mechanisms of all these diseases. And, you put an anemia in front of me and most people are like, I don't care. And I'm like, no, like I'm gonna spend all the time in the world and we're gonna figure out what's causing it and we're gonna treat it. And so you can take anemia, you can take abdominal pain, chest pain. I don't care what the problem is. Like I want to figure it out. Um, so that's part of the reason I like internal med. The other part is you get to develop really, really deep relationships with patients. If you're an outpatient, if you're like their primary care physician, you get this longitudinal relationship. But I've actually almost found it more meaningful when you're on the inpatient side, because in that case, the patient's coming to you in probably one of their lowest times of their life, right?
Mhm.
You don't come to the hospital for just any reason, like especially in the military, right? Like the patients I'm going to end up taking care of. Like if it's a vet or if it's an active duty military member, like they're not coming to the hospital unless like their legs falling off, right? Um, and so to have someone come in their most trying times and trust me with their
Mhm.
complete medical care, right, with their most precious thing, their life, and to trust me to take them under my wing and make sure we get them safely treated and out of the hospital, like that means the most to me. Like it's the utmost honor and privilege to be able to be in that position. And when you walk into the patient's room for the first time,
Mhm.
you've never met them, they've never met you, and they're super sick, and you're trying to come up and make a rapport with the patient, kind of come to terms and figure shit out. Like I think that right there is like a game within itself. Is how do I reason with this patient and how do I make them trust me so I can
Uh-huh.
give them the best care possible, right? So those are all kind of things that I've loved about internal medicine that kind of drove me to pursue it.
Yeah, man, you clearly have a passion for it. That's kind of one of the reasons I wanted to bring you on and give you the stage for as long as it takes was because, like you said, I got introduced to you from someone at my school. His name is EB. He's also is an HPSP, right?
Yep, Health Profession Scholarship Program.
Okay, HPSP, and you guys did it through the Army.
Yep,
So what's funny is you guys got sent off there was it during the summertime between what years?
first and second year.
Okay. So first and second year, you guys all where would you guys meet?
Yeah, we went to Oklahoma first, so it's Fort Sills and Lawton, Oklahoma.
Okay.
Literally no one in the entire city. Like it's literally like what you would see in one of those Western movies. There's
Meow,
literally just
meow,
the
meow.
military
Banjos
base.
start
Yeah.
playing. Yeah.
Yep. But yeah, so we were there, and I mean, we were there in June, and then we went to San Antonio in July. And so you can only imagine. I mean, like San Antonio was like 115 degrees every day. We were
Mhm.
out in the field. We had some good times out there. You know, they stuck like 30 of us in like they had a couple of like really big tents, and they stuck like 30 people in each tent. And there were showers out there. They let us shower for like the first day or two, and then they shut off the water, and they were like, "F you guys, like." Figure it out. And so we
Yeah.
just had like baby wipes and we did all this shit out there. But yeah, that was really fun. Because that when like this training, you know, it's all medical students, it was
Mhm.
dental students and vet students. And so you get a bunch of like really interesting
Wait, the
people.
dental and the vet students
They came with
are
us, yeah.
getting paid by the military?
Oh yeah, you know, I mean the military needs dentists, and the military needs vets too. Like the vets take care of all the military animals. Like you don't think about.
Oh, like military animals. Like I thought they were just dogs. What else they
No,
got?
so they have dogs, they have horses, they could probably
Oh,
they tell you about more. Like I know for sure the dogs and horses. Um and I don't know, but they have a lot of stuff that they have these veterinarians do. They're a pretty big part of like the military readiness.
wow. Okay.
Yeah, it was interesting cuz like a lot of these people I don't really know. Sorry. I don't know if they know what they were signing up for. Like a lot of them came and they were not in very good shape, and I'm like, "Bro, like, you've seen, like, military movies, like, it's not like the movies, but, like, you know we're gonna have to run, you know we're gonna have to do pull-ups and push-ups," and, like, some of these people, I'm like, "The last time you worked out was, like, 2 years ago, like, you know what you signed up for," but so all the guys that were actually in good shape, we all kinda hung out together and kinda led from the front, but yeah, that's where I met, like, EB. You know, we met in the gym on, like, the first day, because he's also big into powerlifting, and so we
Yeah.
lifted together, and I met Ritter around along the way, and so, yeah, it was good times.
No, man. And he said, I remember we were sitting there studying together or getting ready for some kind of bull crap OSCE or something. And he was like, I was telling him how much I was struggling with step two, some different stuff I was trying. And he goes, "Hey, man, you should talk to. It's, my buddy Adam. He's a genius, man. He got a 273 on step two." I was like, "Excuse me?" He said, "Yeah, man, get him a call." I said, "I'm actually gonna take you up on that. Give me his phone number right now." Like, let me see. And you built this incredible, chat bot, which we'll talk about later. But your claim to fame and the reason that a lot of people probably clicked on this video was like they're gonna see that you got a 273 on step two. So you gotta that's insane, right? Like that's kind of I have this meme on my page where it's like, uh, guys only want one thing, and it's this, and it's pointing to a board, and it says like a 274 on step two, and then it's gotten blown up just because everybody's like, yes, dude, channeling this, like manifesting this, trying to get that step two score that kind of like opens doors, mythologically speaking, we're hoping that would happen, right? So, like, you gotta tell me about that. Did you always crush standardized exams, or
Um, Not
how did that
really like
be?
like like I took the MCAT just like everyone else.
Mhm,
You know, I was in Washington D.C. or like Bethesda area when I took the MCAT because I was working at the NIH. I did like a post-bac program there, and I
mhm,
did research for 2 years. And I literally took the MCAT. It was like early January, right after there was like the riots at the Washington like the White House. Like if you
mhm.
remember that when they all like rioted and then they like shut down.
Like storming the
Yeah, like when
Capitol.
they
Yeah,
when
yeah,
they
yeah.
stormed the Capitol and they like shut down all of the city, and so they had National Guard at like every like road, and they had their big ol' like ARs, and they were still allowing people in. And so I'm like, bro, is this like test even happening? And so
Mhm.
like I like left my car like
Wait,
several blocks
wait,
away.
wait, wait, wait. This was on the same day?
No, yeah, so I like my test was like a week after when they brought in
Okay,
the National Guard.
okay.
And so like I had to like leave my car, and then I had like two National Guardsmen like literally had to escort me to the building. I'm like, what the like this is like the most important exam of my life, and like this is how it's going. And like all the buildings were boarded up. The exam ended up going fine, but it's um the reason like I brought this up is shit's gonna go down when you take these standardized exams, and like you're always gonna fall to the level of your training. And so like I had 100% confidence in myself because of the training I'd put in, right? Like I did all of U World at least
Well,
twice for
okay,
the
slow
MCAT.
down, slow down. You start going, and you just go. And
Yeah.
we wanna make sure that we get every single detail down in case somebody is as crazy as you. Because, like, I'm gonna go ahead and say it up front for everybody watching. This is not for the faint of heart, okay? This is not like, oh, just hammer UWorld questions, do UWorld again, do your NBMEs, do your Anki flashcards, and go about it. And you didn't just, and from what it sounds like to me, the reason I asked was were they always easy? Is because like you didn't do it. It didn't seem like you were just one of those people that I read about on the Reddit threads where they started out up at the top,
Hmm.
and they say, "Oh, just do what I did." It doesn't work. From my experience, I'm on the other end of the spectrum. I'm a dumbass, and so when they say, "Oh, just do this," I tried that. It doesn't quite work for me, and so I kind of wanted to see what your starting place was to kind of see what inspired this insane training that you put yourself through,
Yeah,
David
and like
Goggins style.
what I was like I did for the MCAT, you know, I did UWorld like twice, and then I took like a couple practice exams, and like I ended up like my score on the MCAT doesn't matter. Like it was good enough to get into an MD program. Like I think my score was like a 518, which is like what I like I got that's like a decent score. But like the MCAT is like the stupidest test like ever. Like
Yeah,
why
I've
am
seen
I
that.
sitting there reading like paragraphs on this cars section, and like why am I like solving physics problems? Like it's the dumbest thing. It's like just to weed students out. And so like it is what it is. And like so like I that test like I struggled like studying for the MCAT for a while. Things finally like clicked at the end. Um but it wasn't until like I got into med school where like things started to be like it was like more medically relevant, like more clinical concepts that like I was like, oh shit, like I'm actually like I've got a knack for this. Like I know how
Mhm.
to study for this. I don't need to memorize like stupid physics equations and like understand these like philosophical like things in these
Yeah, what was
cards.
that? What was that click for you?
I think like the click for me, like my brain, I'm very like analytical the way I think about things, and I try
Mhm.
to like connect the dots between multiple different topics. And like when we start talking like in this podcast about my tutoring, like the way I tutor is I do a lot through integrations. Like I will connect the dots, and like
Mhm.
the way my mind works, I kind of have like my mind is just like a mind map. Like if you ever seen those, you write
Mhm.
one topic up at the front, and then you just connect everything together. And like
Yeah.
that's the way I see medicine. Like I don't like when I think about a patient with like chest pain, like I'm not just thinking about like the heart or the lungs or the epigastrium or like things like that. Like I'm thinking like full picture, and I have like my differential in my head, and I've connect all the dots, and I when I like look at the lab values, like I try to come up with a picture. And so like the minute I started in med school and I was like, all right, like we're gonna learn the physiology and we're gonna learn the pathophys, and we're going to learn how this presents in a patient, and then we're going to connect this. Like, how would this show up in a real patient? And I started visualizing things like that. Like, things just started to click. Um, and I think like the big thing where like I started to progress towards, eventually getting like a 273 on step 2 was like when I started like, so this is like super important for like your M1s and M2s that are listening to this, is like step 1 in my opinion is a more important exam than step 2. And like I'm probably the only person on
Okay.
this planet that will say that, right? Like
Okay.
that's probably like the hottest take you'll ever you put that as like the pin on this YouTube. Like step 1 is more important. You'll get people who will click on it. Step 2 now, obviously everyone knows, like it's got the score on it, right? They put one freaking score on your head. That's what the residency program directors will see, and they associate you with that score. But guess
Mhm.
what? Like that score, like I'm not sitting for that exam and like just taking it, right? Like that score is a reflection of everything I've done for the last 3 years of medical school, right? And even before that, right? Like some of the MCAT shit kind of matters, but like really, like taking step 2 was a reflection of all the hard work and everything I've done for 3 years to sit for that exam. And really, when you think about it,
Wow.
like step one is all about the physiology and the pathophys, right? Now you tell me, how the hell am I supposed to make a diagnosis, understand the management, understand the complications, and understand all these complex questions you see that they ask in step 2 if I am not a master of the physiology and the pathophysiology first,
Mhm.
right? You can BS your way to getting a decent score, right? But you're definitely not going to score above the 99th percentile if you're not a master of it, right? And like, so like the hot take is if I like fully understand the physiology and pathophysiology of
Mhm.
these diseases that I need to know for step 1, like I have set my base so far and wide for step 2 that I'm building that pyramid higher than anyone else can, right? Like so
Right.
most people they go through the motions on step 1 because they're like I just need a pass, right? And that is the
Mhm.
complete wrong way to go about it, right? I agree with a lot of people like some of the stuff they test you on step 1 is complete nonsense, right? Like some of the biochemistry on there, do I need to know that? No. Like some of
Mhm.
these like random chromosomes of these diseases, like I could easily look that up, right? But
Right.
under like the I would tell you like 80-85% of that this stuff is super important because it's going to set the framework for everything, right? Like if I
Okay.
understand the
So yeah.
pathophysiology of this disease, if I get it presented in a step 2 vignette and they're asking me how do I diagnose it, I know the physiology, I know the pathophys, I can make a reasonable guess, right? Even if I've never like thought about it before, right? And that's the way MBME approaches these exams is they will ask you stuff in ways you've never seen before, right? We'll get into the way I prepared for step 2, but like I like feasibly did everything in my power to be as prepared as possible, and they still found a way on that 320 question exam there's still at least 20-30 questions on there where I like literally like sat back and I was like, holy shit, this is a really good question. Like I was like, I've never thought about it in this way before, right? But
Mhm.
when you get presented with something like that, if you understand the physiology and the pathophysiology, and if you put in the work, you can take a step back and you be like, all right, I've never thought about it like this before, but I still know the mechanism of like the broad scheme they're talking about. So I can make a reasonable guess, right? So
Right.
the big thing that kind of like slowly started to set me apart. It wasn't my third year of medicine when like I was preparing for step 2
Mhm.
that all of a sudden I was like, oh, you're a 99th percentile score. It
Right.
was the first day I stepped into medical school. I was like, I'm fucking him, right? Like, and no, you don't I don't walk around like that. Like no one should walk around like that. But that should be your mindset in your head, right? Like David Goggins, like you can't touch me.
Mhm.
And so like
You don't know me, son.
yeah, you walk around and like it's a mindset. And I'm like, all right, like I'm not here to just superficially memorize like a bunch of Anki cards. I'm here to deeply understand the physiology and pathophysiology because one day that physiology and pathophysiology is going to help me save someone's life, right? And so like
Yeah.
the way I think about it is like a lot of medical students and like I've been in this boat too, like and I really have to quickly course correct myself, but like you'll get in a rut where you're like holy crap, like I do not want to study today. Like I don't want to go to class. Like there's so many things I'd rather be doing. And you
Mhm.
just have to like flip the switch and you're like, no, I don't have to go to class. Like I get the opportunity to go sit in class and listen to one of the world's experts, right? A physician or a PhD talk about the subject that they love. And that I get to sit there and I get to learn from them and ask them questions because one day it's going to help me, right? Or I get to sit there and I get to do 40 practice questions, and
Mm-hmm.
I get to make mistakes, right? Without it actually impacting a patient. I get the opportunity to make mistakes, to course correct myself, so that one day when I'm presented with a patient with this exact situation, I know what to do, right? Um,
Right.
and so it's going through those motions. It's flipping the switch early on that's going to set you up for greatness later on, right? So it's like putting in the work now so you can reap the benefits later. My wrestling coach in college, he always used to say the hard work is the journey, right? Like you
Mm-hmm.
get the opportunity to do this immense amount of work to one day call yourself a doctor, right? Like the the reason it's the greatest like field, and we've already talked about it, like you get to be in charge of a patient's health, right? Like it is the most beautiful art and the most beautiful science combined together into one career. And there's a reason, like everyone growing up wants to be a doctor because it is the best, right? But if it was easy, everyone would do it, right? It's not
Right.
easy. It's super freaking hard to get into medical school nowadays. It's super hard to score well on these standardized exams. Now
Mm-hmm.
it's super hard to get into most residencies even, right? Like I mean you're about to match into ortho in a year or two, right? You understand the struggle more than anyone else probably. So like there's a whole reason for this, right? Is like you have to put in the work. You need to enjoy the work because one day it will pay off. Um
Right. So your hot take, the first thing you said was setting up a foundation and setting up a mindset.
mhm,
So if we're talking to somebody that is in that mindset, I've talked to a lot of people who were very much like, I just want to go into family medicine. I just want to go into internal medicine. And then, so their mindset, they're already down here
mhm,
for themselves. They just want to pass. And that's cool. And so and I'm not shaming them because I was lucky. I think I was lucky to pass, right? I thought I was doing a lot of good work to set that foundation up at the beginning. So if you could give dummy Caleb advice for day one stepping foot in med school, like for context, our structure was you have in person or virtual lectures. We get 4 or 5 lectures a day. So over the course of a week, you have 16 to 20 lectures, 50 to 60 slides each. And it became for me in my experience, or lack thereof, it was overwhelming.
mhm,
And they held us to a standard of having to pass our quizzes every Friday. And so I had to know all that material leading up to that Friday quiz. So my mindset got into a very rushed, let me just hammer it. I think I even talked to one of my buddies. My roommate actually, we were studying together one night, and I was trying to come at it from this really intense mindset of like, I'm going to be saving somebody's life someday. I need to have these antibiotics and this immunology really understood from a conceptual level. And he's sitting there doing his Anki cards, and he's much smarter than me. He'll know exactly who he is. And he's like, "What are you stressed about over there, man?" And I'm like, "Dude, I need to understand this." He's like, just dude, it's antibiotics and bugs. Like, memorize this shit, man. And I'm like, you don't understand. We're gonna be doctors. He outscored me on every exam. I mean, he's just naturally more gifted than me, I would argue, but he works hard and he's consistent. But
mhm.
so talk to that person that wants to have that mindset um, on day one, so they don't get overwhelmed and they
Yeah.
can digest it from that intense long-term retention standpoint.
Yeah.
If you can, yeah, if you don't
Yeah,
mind.
again, absolutely. Like so one thing I'll say is like for the people applying like family med, internal med, peds, whatever, like consider maybe like the less competitive specialty. Like that's the biggest cope I always hear from students. It's like, oh, I just need it like a 240 or like whatever. Like that's totally fine. Like that's BS. In my opinion, I want my primary care providers to score higher than my dermatologist, neurosurgeon. Like you're like the thing about the level of knowledge you need to have if you're going to be a hospitalist, you're going to be a primary care provider. You
Right.
physically need to know like everything, right? Like I don't need to know it to like the specialist level, but I need to be able to recognize certain
Mhm.
diseases and know when to send them to a specialist. So like that's like I hate when people say that. Like I'm applying internal med. Like like if you like this is gonna piss people off, but I was mad at my 273. Like I knew I could do better. Like I'm like honestly like and the fact though is like when you
Jeez.
get to that level on an
Right.
exam, like the difference between like a 273 and like a 280 is like a couple of like dumb mistakes and a couple questions here and there. But I'm
Mhm.
like I totally could have like gotten better than that. And so like that's just like the mindset, like going back to like the real thing you were asking is like that mindset, that mental toughness. Like I define mental toughness as like this relentless pursuit of greatness despite all the obstacles, right? And that it's not something that just happens overnight. It's not
Mhm.
something that happens in a week or a month. It takes many years. Like I developed it through wrestling in high school and college, playing other sports. Like you get your ass beat every single day in the college wrestling room, and you still have to show up. You have to make weight every week. You have to practice twice a day. 6 days a week. Like if you make it out of those 4 years in the wrestling mat, like in
Mhm.
college, like there's nothing that can touch you, right? And so like that's kind of how I built it. But I understand most people are not going to have that experience. So you show up to medical school day one, and like, what are you supposed to do? And it's extremely
Right.
overwhelming. And what I'll tell you to start with is, yeah, maybe you weren't a college wrestler, but there's something in your background that made the medicine committee at your school pick
Mhm.
you, right? Like it was not. It's I always tell this. Like I've worked with over 300 students at my school. I tell every
Wow.
single one of them there's something that they saw in you that made them choose you, right? It was never a mistake. Like you're supposed to be here. So you have that dog in you, right? You've seen those memes with the X-ray. They have the dogs in their lungs, right? You have that dog in you. So you have to find that, right? And so yes, like stepping into med school first day, and like you have a quiz every week. You have like hundreds, if not thousands, of slides to go over. It gets extremely overwhelming. So this is how I break it down to my
Okay.
students. At least at my school, we have access to Amboss. Like they give access to Amboss to all the M1s right off the bat. Um, and so the students are often stuck with, okay, do I do Anki? Because I've heard all this great things about Anking. Do I do Amboss? Do I do both? Do I go
Yeah.
to lecture? Right. And so like here's what I recommend is like I was always someone who went to lecture in person, right? Um, if at my school the exams were written by the professors, we didn't
Same.
have like MBME exams, right? If you
Mhm.
have MBME exams, then I'll tell you maybe you can get away with just doing like all third party stuff. Like some schools are
Yeah.
different, but like in my opinion, right? Like one, the professors teaching the lecture are the ones writing the exams, right? And so like oftentimes like you'll sit there in a lecture and they will go over the educational objectives and they'll literally tell you what's going to be on the exam, right? The educational objectives on the first slide of every freaking PowerPoint, whether you believe like see it or not, those are the questions they're writing the exams on, right? That is what like they're literally telling you at the end of this lecture you should understand these 10 concepts. No shit, like that's what they're going to test you on. Don't worry about all the other random stuff, right? But like that number one. And like I was one of 5 people that went to lecture in person. Like we literally had like there was 5 of us that went. um,
Same. There
and
was
so
a
like
group. Yeah, there's
yeah,
always a group. Yeah.
and so like if you don't want to go in person, whatever, if you want to watch it online, whatever, if you want to watch third party, whatever, right? You need to watch some sort of content to get your background, right? So it's either one of those. And like in my opinion, going in person, one, it keeps you on a rhythm, right? So like I'm someone like for me, I wake up at between 0230 and 0300 every day. I do a little bit of studying. I go train. That's either the
Yeah.
gym, running, both, jujitsu. And that sets me up for the day. And then I'm at like M1, M2. Our lectures would start at 0800. And so I'd be there and we'd be ready to rock and roll. And like for me, one, it keeps you on a schedule, right? It keeps me disciplined. Like I know I'm gonna be at school every day before 0800 Monday through Friday, right? That keeps you on a plan. The other thing for me is it's out of respect to like the professors and the doctors that are coming to teach, right? Like they're taking time out of their day to teach you about a topic that they love, that they're an expert in. Why would you not show up in person, show them respect? And then if you have a question, I don't need to email them and hope to God that they email me back. I can just
Mhm.
walk up to the lecturer after and ask them a question. They love talking about the topics that they teach, right?
Mhm.
So that right there. So first things first, you need to go to lecture and you need to digest the material, right? So for a lot of
Was
people,
there
it's
any prep? Was there any prep before the
no.
lecture
So
though?
like I remember I watched YouTube videos on like how to prepare for med school and like how to and like every single one of them was like I would read the lectures before I went
Right.
each morning,
Right. I think
or
that's
like
what I
I would read
tried to do. It was not
and I'm like,
sustainable.
there's not enough time in the day. And
Mm,
like, if I've never heard about this topic before, which like 90% of the stuff I learned in med school, first and second year, I had never learned before, right? Like, I did not learn about that stuff in undergrad, right? It was all new to me. Um, and so like, if I'm like, I'm gonna sit there with 100 slide PowerPoint on shit I've never learned before, what good is it gonna do me to sit there for an hour and read through it? I'm like, that's not helping me, right? Let me wait. Let me see how the lecturer
right.
goes through it. And for me, I'm not one, I don't take notes, right? Like most people sit there and frantically like write notes and they literally like try to verbatim write what the professor says. I'm like, that's
Waste
doing
of
you
time.
nothing. I sit there and I listen. And if they say something important, I make a mark on it on the slide. Or if the gears start turning in my head and I'm like, wait, this concept on slide 50 relates back to what they were talked about on like slide 3, right? I make a note of that and then I go back and I read it, right? So that's first things first. Try to start connecting ideas, look at the educational objectives, because you're gonna be so stressed for time, right? You're gonna read all like they're gonna have 100 slide PowerPoints, but they're gonna give you 10 educational objectives, and that's really what they want you to get out of it, right? So like what we've talked about before, you and I, is like if you're stressed for time, take those educational objectives, throw them into ChatGPT, have ChatGPT spit out like what they think, like how to answer those educational objectives, and then you become a master of them, right? So
Mhm.
one thing you can do, right, if you're like, oh my God, I do not have enough time to sit here through all these lectures. Again, take the educational objective, throw them into ChatGPT, have them spit them out, and then you can do several things with that, right? I call one of them like the samurai method, where
Mhm.
basically I just brain dump whatever I know about a topic, right? So I can pick the educational objectives and I can just brain dump whatever I can remember about it and have ChatGPT course correct me, right? So like one, it will tell me this was all right. You forgot this. This was wrong. Recorrect it to this, right? And I go until I get it right, right? And like my motto is most people won't go to this link, but it's like I don't practice until I get it right. I practice until I can't fucking get it wrong, right? Like most people will not go to that level, but like you practice, practice, practice because one day you're going to take that standardized exam.
So how do you test yourself to see if
So
you got it
yeah,
wrong?
so it's doing that samurai method, and then you can have ChatGPT make you open-ended vignettes or multiple choice vignettes based off the educational objectives, right? So that
Mhm.
right there, super high yield while you're trying to digest this information. The next thing I'll tell students is like you can absolutely use Anking. I have beef with Anki. Like I used Anki my first year of medical school. I thought it was pretty good, but the
Mhm.
minute I started like transitioning over to practice questions was another time where I felt like the switch in my gears where I kind of threw Anki aside and I was like, we're taking practice questions from 0 to 100. Like I'm going like full bore on them. And I'll get into that in a second.
Yeah.
Um, like Anki is great, especially when you have these pre-made cards. Like I don't have to do any of the work. But man, like the more I did Anki cards, after I saw the card like 5 or 6 times, I would just recognize like the first couple words of the card, and then I already knew what the answer was without actually memorizing the concept
Okay,
or
yeah, so can I
right?
pause you for a
Yeah.
second? If somebody was making their own cards, or if they were looking for another pre-made deck, you know, what would those cards consist of? Because my thought process was, and I found this really helpful during step one, was I found it a little too late, but it was these like one-liner questions that force me to recall everything about
Mhm.
SLE, for example, or some other pathology, and I had to sit there and go, yep, it's associated with these markers. Okay, would what? Tell me what your perfect Anki deck would look like.
So that right there is the perfect Anki deck is like vignettes or one-liners where I actively have to recall like a set amount of information, right? Like
Hmm.
differentials, associations, management, complications, X, Y, or Z. It's like the stupid Anki cards where it's like just like rote memorization, which yes, in medicine, there are going to be stuff you're going to need to rote memorize. Bugs, drug mechanisms, some of those like chromosomes and translocation,
Yeah,
you're just going to
yeah.
have to memorize them. But like what we talked
BCRABL baby.
yeah, like what we talked about for like at the beginning is like to truly understand the physiology, pathophysiology, you have to go beyond the memorization. You have to truly understand
Hmm.
what's going on, right? So like cards like that, if you want to make your own cards like that are these open-ended vignettes and you have to actively recall, that's perfectly fine. You have to understand it's going to take you time, but it's an investment, right? I'm investing time up front, so I better understand this information later. And I'll kind of like step upon that as we move forward, but like with that, so you can think about, I could do that for Anki, right? Anki is great because it has this spaced repetition. So I can be like assured I'll see the material over and over and over again. But
Mm-hmm.
really, I found that when I switched over to practice questions, right? So I went from doing like some AMBOSS like every week to like, all right, before every exam, before every system exam, I'm doing every single AMBOSS question available. And then I'm redoing my wrongs. And then I also we got like boot camp, med school boot camp for free.
Mm-hmm. I've seen.
Because there's like
Wow, y'all got your
no,
money's
yeah,
worth.
no, like, boot camp was free because it was like their first year and they gave like a code or whatever.
Yeah.
Amboss is like included in our tour. Like we had to pay for that shit. Well, actually, the
Mhm.
army paid for mine, but like whatever.
No, UWorld.
So we got UWorld closer to step 2. We got UWorld like 6 months before step 2, and I'll get into that in a second.
Okay.
Or sorry, 6 months before step 1, and then we got it before we started rotations for step 2. But I'm like on step 1 lamb, when I switched over to Amboss and I was like, all right, we're going to do all the practice questions before the exam, redo my wrongs. And I'm going to do all the boot camp questions too, right? Because we didn't have UWorld at that time. And I started to see, okay, like they're going to test me on all like the really important concepts in multiple different ways, right? So like HEMONT, for example, like you brought up like CML, like the BCR, ABL, like they're like feasibly on Amboss for step 1. There's probably like 5 or 6, if not more, CML questions, right? So
Right.
like it could be my first day of HEMONC. And I'm like, will you expect me to do the Amboss questions? Absolutely. Like start them, right? And like, so I'm gonna do it's my day 1 of HEMONC, and I'm like, I know nothing about HEMONC. That's great. Like you're literally a sponge, right? So like I do 10 Amboss questions and I go 0 for 10. Oh well, right? You can sit there and you can cry about it, or you can sit there and for those 10 questions, you can read. I love Amboss because they have like that attending tip, and it's
Yeah.
like this symptom plus this symptom should have keyed you in on this disease, right? Um, and then I look at why is the right answer right? Why are the wrong answers wrong? And I put it into my head, right? And what I can do is Amboss is really good, UWorld's really good. They have like those articles that are built in. I can read
Mhm.
more about it in the article. If I'm like, oh, I need more, copy and paste it, take a screenshot, throw it into ChatGPT, have a conversation with ChatGPT. Like, hey, I don't understand, why does CML show up with basophilia, right? What's the deal with this leukocyte alkaline phosphatase score, right? How is it different in CML versus a leukemioid reaction? Like, help me make sense. And I can literally have a conversation with a world-renowned tutor, right? ChatGPT knows everything. So that right there. And so like I tell students all the time is like, don't worry about your Amboss and UWorld score. Like your
Right.
first week of a unit, you're going to get absolutely wrecked. Like you'll be lucky to get a 20%. But the beauty of these question banks is like, that's not going to be the last time I see a CML question. There's going to be
Right.
another one. Maybe it's the next question. Maybe it's in a week, whatever. There's going to be another one, and it's going to approach it from a different way. But the vignette is more like there's only so many ways CML presents, right? So like the vignette is going to be more or less the same. So like I read the vignette, and maybe I had no idea it was CML the first time, and now I'm like, oh, this sounds like CML. But maybe I don't remember the BCR able mutation. Fine, right? That's something put on an Anki card, right? But the cool thing about this system is if you do all the questions and then you redo your wrongs, there's space repetition right there. So like
Okay.
the
Okay.
reason
So you're a big fan of doing your wrongs.
redo your wrong like that
Okay. And
that
what
is
would
the
you say to
key.
people that say that's you're just remembering what you put last time?
So and like there's always gonna be that, right? And so like the longer you can go in between doing the first pass and the redo, the
Mhm.
less likely you are to have just memorized like the question. There's
Right.
always a problem with that. But then let me teach you how I attack practice questions. And this is part of the
Okay.
reason, you can score pretty high on a standardized exam and do really well as like a real practicing doctor, right? Is like when I read a question, I read the last line first, and it's like, okay, the question is asking me what is the diagnosis. So then I read the vignette, And I know as I'm reading the vignette, I have to come up with the diagnosis. Or maybe like step one land, they're asking me, what is a pathophys? Now I don't necessarily need to know the exact pinpoint diagnosis. I need to know generally what's going on and then come up with the pathophys, right? So stuff like that. I read the vignette and I never look at the answer choices. Never ever, right? I try
Okay.
not to. Okay. Amboss has a really cool feature on your phone where it literally will block the questions for you. But if you're doing them on your computer, just don't look at the answers, right? And I come up with a prediction of the answer in my head. And like for the vast majority of like Amboss, UWorld, Bootcamp, MBME, you'll be able to predict, like you can predict the answer. There are always those questions where they write the answers in like weird ways where like A and B are polar opposites and C and D are polar opposites. In that case, you can't predict the answer. You're just gonna have to
Yeah.
look.
Let
But like,
me and let me and let me ask you a question while we're
yeah,
on the subject, because I think this is probably the highest yield part of this talk that we're having
mhm,
today. Especially because I'm taking step 2 and on Halloween.
okay,
And this is after pushing it back just because I just, wasn't ready. Because and this is I wish I had known these kind of skills and strategies and stuff early on. Only recently by talking to you and others have I started to try to employ it, and it's painful because sometimes I'm reading, I look at my question, I read, and either I can't get the answer to come out, like it just doesn't come, or I'm like, yeah, I'm pretty sure I know what's going on. And you look down at these MBME question choices, because that's where I'm at. I'm looking at MBME material at this point,
mhm,
right? And I look at these answer choices and I'm like, ooh, these all look good. Because I knew like the answer in my head, they took it a step deeper.
mhm.
So speak to the idiot that you're tutoring here and share with them. Give me the harsh reality of what I'm experiencing in that moment.
Yeah, and you're not an idiot. Um, but that happens to a lot of us. And especially early on,
Mhm,
that's where you have all these like growing pains. Um, but by getting to a point where I can predict an answer and then find the most reasonable choice that is like close, pick it, cross out the wrong answers and move on. Like that's how you know you're ready. Um, one, because like MBME, they're professional test writers, right? They do this for a living. They know exactly the wrong answer choice that students are going to pick, right? And they know exactly what to put as other answer options to make them really enticing, which
mhm,
is what you literally just said. Um, and like developing this further, like think about yourself when you're an intern or when you're on your sub eyes, right? And like you're actually in charge of a patient. And when a patient presents to you and they have a chief complaint, I don't get five multiple choice options that sit above their head and be like, "Yep, B sounds right. Like I'm gonna do that." I actually know what I need to ask the patient. I actually need to know what imaging, what labs to order, right? So this is only gonna set you up for that, right? So it sounds like when you're like you come up with an answer in your head and then
mhm,
you're like, "Ooh, they took it a step further," or like, "This was not at all what I'm thinking." That's where you have it's more or less an like a conceptual problem, right? Like, and this goes back to what we talked about. Yeah, sorry. That's like in my opinion. That goes back to like if you truly understand the physiology and pathophysiology, and I actually know like what is the core mechanism of this disease, and then understanding that, I can feasibly take steps and extrapolate and think about how would I diagnose this, how would I manage it, how would I like manage these complications, even beyond like what the first line tests are.
mhm,
And so like let me give you an example. I teach this to all my students, right? If you're about to sit for step 2, 100% of the students that are going to sit for step 2 or complex 2, whatever it is, they will know if a patient shows up, they give you a vignette and it's like screaming at you ischemic stroke. They will know the first step is you get a non-contrast CT, right? 100% of the students will that are sitting for that exam will know that. If you don't know that and you're sitting for step 2, you made a big freaking mistake, right? So like 100% of the students will know that, okay? So
yeah,
what do you think the odds are MBME is going to actually write a question where they give you a patient with ischemic stroke and say, what's the next best step? And they haven't done a non contrast CT, right? Very like slim to none. Every now and then they do questions like that to give you like free points, right? Make you
mhm,
feel good. Because
and
that's
then
the world we live in.
they crush
Everyone
you.
needs, yeah, then they crush you. Um, So like the odds are pretty slim, right? So
Uh,
in the vignette, they're going to give you that we got an on-contrast CT, and they're either going to describe the findings or they're going to give you the actual CT imaging and make you kind of deal with it. And then they're going to ask you what the next best step is, right? And then we take that from 100% of students to now 75% of the students know within 4.5 hours we can give them fibrinolytics, right? We can give them TPA, right? So now we've got it down, right? And then what do you do if MBME says, okay, it was an ischemic stroke. They are beyond the 4.5 hours, right? Or maybe they're within the 4.5 hours and we do this. What do we do next, right? Do students know right now we took it from 75% to like less than 50%? No, we need to get a CTA of the head and neck and we need to look for the thrombi, right? And if they have them, right, we can do further steps, right? Like, so we take it down, down, down. And like the reason like I go through this with students is like, if you just like did Anki and just superficially understood stuff, you would know probably to the point of getting the CT. Maybe you would know the the TPA. But then beyond that, if they ask you anything beyond that, like
mhm.
you're not getting that question right, right? Um, so you truly need to understand the physiology, the pathophysiology, and as many of the next steps as possible, because that's the way MBME is going to approach it, right? And you've seen this in your practice questions is like they will literally make things so vague, and you truly have to be an expert at the physiology, pathophysiology to understand where they're coming from. And honestly, like at this point, like it's just doing more MBME questions. There's only so many ways they write about COPD or acute coronary syndrome or AFib, right? Like their vignettes are they're kind of like reused over and over again. They make slight variations to them and they approach the question from different ways, but more or less the same. And so like
Mhm.
now that like I've kind of mentioned this, like we can get into how I study for step two. But like what you're getting at is like you either have, and like this isn't just you, but it's like other students. There's either like a conceptual problem where you're not fully understanding the physiology pathophys to make further connections when they give you those tricky options, or you haven't done enough MBME questions to understand how they like to ask about these certain concepts.
Okay.
Um,
Okay.
and
So
so like kind of
before,
yeah,
yeah,
go
go
ahead.
ahead. No, you go
I
ahead.
was going to say, the last thing I want to say on this point is like, if you read a vignette and you're like, oh, I 100% know this is asthma. And I know that in the treatment of asthma, we can give them like a beta 2 agonist, right? And then you read and like that's what they're asking you. It's like, which of these is the treatment? And you're reading and they have 5 different drug names and you just completely space that albuterol is a beta 2 agonist, right? When I read a question like that and I 100% knew asthma, 100% knew beta 2 agonist, but I forgot about albuterol, like I forgot that that's a beta 2 agonist. That's a memorization problem. That's something you can easily put on an Anki card, do it for a couple days, you'll never forget it. You'll remember it for the rest of your life, right? But if I read the vignette and I'm like, I had no idea this was asthma, right? Like I thought this was like some random, like I thought it was restrictive lung disease. I don't know. Like, and like, because they gave me like the PFTs and I'm like, what the hell's going on here, right? So if that happens, that's not
Mhm.
something you put on an Anki card, right? That's a conceptual problem. That's like, I need to go back. I need to go read a quick article on Amboss or UWorld,
Mhm.
Age and First Aid. I need to talk to ChatGPT. So if you're going through that and like you just have a brief memorization problem, but you totally know what's going on, Anki it. If you're like, man, like I didn't even know this was lupus, or like I have no idea how to work up lupus, that's a conceptual problem. You're gonna get every single question of lupus wrong if you don't
Right.
understand like the basics of it, right? So that you need to go back and course correct. All right, I think that's what I wanted to say on that
I'm
stuff.
looking for a pen because I got to start writing some stuff down. You know what I'm saying? Because we got to get this to at least a 250 plus, man. Like, I don't think we'll get now. There's a few things I wanted to address, but I want to make sure that we are helping people as much as possible. And so, just to recap, setting your foundation is the ideal scenario. And of course, not everybody's going to be there. But you want to start off strong. That's obviously the most ideal scenario to where you're getting into these good habits of question skills and study habits and deep understanding during first year. Um, now did you, mm, just to kind of touch on this real quick for step one prep, and I think this will help answer a lot of people's questions. It sounds like when you start talking, the conclusion I'm coming to is that you're not as concerned with the resources that you're using, more so the mindset that you come in to in understanding the information. Is that what
Yeah,
am I?
that's very fair. Like, I think, in my opinion, there's so many good resources out there, and students get so overwhelmed by them and that they try to like dip their toes in all of them. Man, pick
Mm,
one, pick two, and frickin' be the best at it. Like, run with it and finish it, right? And so like the way you look at like all like question again, like questions are king, right? Like I can sit there and I can passively do Anki. I can passively rewatch videos. Like again, you're gonna
mm,
have to watch videos or lectures at the beginning to at least gain some understanding. The biggest mistake I see from students is like over the summer or while they're prepping for their exam, they rewatch like all the boards and beyond. They're like, I suck at cardio. I'm gonna rewatch all the boards and beyond. I'm like, great, you just wasted 30 hours of your life rewatching this because you're sitting at a screen and you're just passively trying to absorb. And you're like, yep, this is sticking. Or I can sit there and I can do 1,000 cardiology questions. I
mhm,
can suffer through them, but I'm actively thinking through them. I'm
right.
actively thinking through every single answer choice they're providing me. I'm reading the explanation, I'm making connections, and I'm actively thinking. And so, like, the way I go about it is like whether it's Amboss, UWorld, TrueLearn, Boards Vitals, what a bootcamp, name any one of them, they're all good, right? They're all taking from that USMLE content outline and they're making questions based on what USMLE is telling us is going to be on the exam, right? Some I
Mhm,
think are better than others. Like I think UWorld and Amboss have proven that they're very consistently good products, and that they're going to get you right. And so like pick one and just run with it, or be a baddie and do multiple, right? But you have to finish like all of them, right? It's not like doing half of Amboss and half of UWorld. It's
yeah,
doing all of them, right? Um, and so like I don't like people will like complain and they'll argue about which one's better. It doesn't matter, right? If you come in with the mindset of like, okay, I'm not just going to answer this question, I'm going to truly understand it to the level at which I could explain it to not only a first year medical student but to one of my patients, you understand the material, right? And so I think like that's one of the other core concepts is like teaching is learning, right? It's the Feynman technique. It's
yeah,
extremely well known. But like with me being a tutor, like I've tutored again, like I've worked with over 300 students. I've given over 50 lectures at my med school. I just like hold my own lectures, and actually at one of the more recent ones, I had 120 students show up to it, which like completely blew my mind because the first lecture I ever gave, I had 2 students show up, and I was like, as long as one shows up, I'm giving it 100%, and I'm going to show them how I think through these concepts, and I'm going to make them understand, right? And like so word spread and eventually you get the whole school that comes, right? And so like when
wow,
I stand in front of this group of students, they're counting on me to be able to explain it, right? And so like I need to be a master of this content, right? Not to a level that, oh, I can just recall and pick it out of a group of multiple choice. Like no, like I need to be able to explain it off the top of my head, make integrations, answer any question they have, and make sure they understand to the level of a first, second, or third year medical student, right? Obviously, they're at different levels of their education. So when
right,
I work with like a third or fourth year medical student, I can make so many more integrations. I can test them even further. Whereas, like for my first year medical students right now, they've had foundations of medicine and hemonc and immuno. So like I can't ask them about like cardiology consequences of like doxorubicin, right? Like a hemonc drug that they've learned about. They probably shouldn't know that, right? They don't know what dilated cardiomyopathy is, right? But if it's a third year medical student, you better believe I'm going to ask them about that. Um,
mhm,
so that's super important. But then you think about it, let's take it one step further. I'm
okay,
not here just to teach first, second, third year, fourth year medical students and interns, residents when I'm an attending, right? You as a doctor, right? Doctor in Latin means teacher, right? Your job as a doctor is not only to take care of your patient, but it's to empower them and be able to teach them about their disease, what's going on, what your thought process is on the treatment, so you can empower them so they can advocate for their own health, right? And so if I don't understand the physiology and the pathophys to a level at which I can explain it to like a fifth grader, because that's really like the level of medical education most people have. If I can't do that, I'm doing my patient a disservice, right? And you are literally, you could be the smartest doctor on earth, right? Like you could be able to decipher any lab value, any imaging, whatever. But if I can't explain it to the level at which the patient truly understands what's happening in their body so they can make an informed decision, I have failed my patient, right? That's
Mhm.
the way I think about it, right? So getting up there and being able to teach to someone else is going to solidify this information far beyond what you need for step 2 or step 1 or things like that. So another like really helpful thing, you don't have to be a tutor at your school. You don't have to get up in front of 100 people and tutor. Find a buddy and just teach, right? Say, hey, I'm going to teach you what I know about lupus. You're going to look up things online on ChatGPT, correct me. You're going to teach me about rheumatoid arthritis, right? Stuff like that. You don't even need a buddy. Now with ChatGPT being so good, I just teach ChatGPT and it course corrects me, right? Um,
Mhm.
so doing that, super duper powerful.
Wow. Okay. So we've set the stage, and you've I am assuming the first MBME that you took for step 1, 99%, right?
Not quite that high, but I guess
Okay.
so it's like in my head, right? So like I did all of U World and then I
Mhm.
redid it. I'd also done boot camp in Amboss. So like I did well over like I probably did like 10 to 12,000 questions for step 1. Which is probably more than most people would. But like I again like I wanted to understand and be really really well versed on this stuff. And then I took I want to say I took the CBSE, which like our school makes us take. It's like a 200 question MBME style step 1 exam. I think it's like the basic science clinical exam or something, whatever.
Right.
I did that, and then I took 2 more like 200 question MBME exams, and I told myself I'll take the exam when I get a 90% on one of them. On the second one, I got a 90%. I'm like, all right, we're ready. I tell most of my students like the passing score for like step 1 now 62, 63%. It's
Mhm.
somewhere around there. So I tell them if you feasibly can get above a 65 twice, I have confidence that you can go into the exam. You have a little bit of wiggle room. I would like for most of them to score above a 70%, right? But I tell them, hey, if you can get a 65 twice, it wasn't an accident the first time, you're good to go. Um, for me, like I wanted that extra like bit, like so I could be like, all right, I could go in, it could be my worst freaking day of mine. And then really it's that mindset. Like every day, like literally every day for as long as I can remember, I wake up and I'm like, I'm freaking dominating this day, right? But for the step exams in general, I vividly remember both before step 1 and step 2, I wake up and I'm like, wow, like this is gonna be such a great day. Like I feel so bad for these MBME test writers because they've spent their entire academic career trying to write the perfect question, and I'm going to get every single one of them right, right? Like, I was like, I'm going to do so well on this exam. They're going to have to open a file on me and see, was I cheating on this exam, right? And like, obviously, like, no one gets 100% on these exams, right? They're super freaking hard. There's always questions where you're like, what the hell just happened?
Yeah.
If you go into these exams with any mindset other than that, like, there's so many students that go in and they're like, it is what it is. Like it's a coin flip. I'm like, you're literally already setting yourself up for failure. I don't
Right.
even care if you pass the exam. If that's your mindset, like I don't want you like I don't want you to be my colleague, right? If that's like the way you think about it, right? You need to have the utmost confidence in yourself, right?
Mhm.
Um, and so like that's what I try to teach the students as well. And so like having that mindset, like challenging yourself, like that's the ultimate like thing is like truly finding challenges, like sitting in front of my computer, watching videos, not challenging. Doing these hard ass Amboss and UR questions, very challenging. And when I write these lectures for my students and I write my own questions, I make my questions far beyond what I think MBME like more challenging than that, right? Because I'm like, all right, I don't care if these students get it right, but if they understand my reasoning for these questions, there's not a chance MBME is going to trick them on any of this stuff, right? So it's finding those challenging things, building that confidence, and then doing everything I've said before in prep that when you walk into that testing center, that prometric testing center, like you're dominating. Like there's no other option. Like it's domination.
Something
They
that you say a lot that I love. I picked up on it while you were on rotations. We were texting about it. And for everybody listening, all 5 of you,
yeah,
you're everybody else is missing out. But I was checking in with you, and you were very hard to get a hold of because you were so focused. And when you are on a mission, like that is your main priority, and I respect that a lot. And you said, I'm leaving no doubt, right? Like you show up and you put it all on the table and you leave absolutely zero doubt in your abilities for that mission.
Mhm.
And I respect that a lot. So where did that come from?
Yeah, I mean that like my buddy and I back in college wrestling, we always used to say no leave no doubt and no prisoners. Like we're not
Hmm.
taking any, we're like literally just dominating. So that same wrestling coach, he this is actually it's a quick story, but like the
Okay.
reason I ended up getting into medicine, I went into college to wrestle. I didn't know what I was going to do, but that college wrestling coach, he actually ended up getting diagnosed with glioblastoma my second year, my sophomore year.
Yeah.
And this guy, he was assistant coach for the U.S. Olympic team before he came to our school. He was in his 60s and was more fit than like most of the people on the team. He was like literally like he was David Goggins. Like he is like true life.
And
Like
what school
right in
was
front of
this?
my eyes. This was my head wrestling coach. Um,
Well, what school was this?
oh, Cornell College in Iowa. Yeah,
Oh, you're a Cornell boy. Okay.
yeah.
It's cool.
Um,
That's all
so
right.
but so he used to tell us a story. Him and our assistant coach, they would tell us a story about how the Vikings way back when they would come to a new piece of land, they would burn their boats, and they would burn their boats because that would only give them one option, and the one option is either to pillage and like win the new land, or they would die. Right? It's either they gave themselves no retreat, and like the minute he like told me that story, I'm like, holy shit! Like this is like there's levels to this, right? Like
Yeah.
I would go into wrestling practice like before that, and like sometimes I would just go through the motions, and I'm like, this is why you lose, Adam. It's because you're just going through the motions. And the minute I'm like, we're not going through the motions, we're leaving no freaking doubt. Like I will go on that mat, and you're gonna have to pull me off of that freaking mat because I had worked so hard for 7 minutes, and I'm so freaking tired that I can't even stand up, right? And so like it took me 4 years to be able to do that, and I literally just pushed it over into everything I do from now on. And so like
Mhm.
when I do something and it has my name attached to it, it needs to be 110%, right? Like I'm stealing 10% from you to put into my project because you can't go above 100%. That like whenever I say that, people are like, well, you can't go above 100%. I'm like, yeah, because I'm taking 10% because you're not working for it. And so like, but like the thing is like if my name's on it, it better be the best, right? And so like I'm leaving no doubt that like my work is the best. And like as a medical student, as someone who's still learning, I make mistakes all the time, and it's the perfect time. But you better believe I'm making mistakes at 100 miles per hour. Like I'm giving everything I can, and then I have someone who's more experienced than me push me in the right direction. Um, and so like really with that, like it's again, it's that mental toughness is like you just have to be willing to outwork everyone else. And like for
Right.
me, like I'm not the smartest, I'm not the strongest, I'm not the fastest, but like there's not a doubt in my mind that I'm up before you, I'm working harder than you, and I'm gonna get the job done better than you. And like that's just the way I live my life. And if like I don't like I'm not cocky, like you ask anyone, like I'm extremely humble, but I'm coming off this way because I'm trying to portray that like this is the mindset you need to have. And it's not like you're not going to stab your student, like your classmates in the back. Like no, you're going to help them, right? And like that's the kind of experience I've tried to build at the Medical College of Wisconsin. Here is like I go out of my way to help others because I've been given this gift of being able to teach in a way that makes sense to students. And so like why would I keep that to myself? Like I'm trying to help everyone around me be just a little bit better, right?
And that's one of the reasons that we connected was because I mean, we're working on a project together to help medical students
Mhm.
for the foreseeable future. We'll go ahead and say it. But I needed somebody who wasn't looking for a quick buck because a lot of medical students like myself don't have extra dollars to give away. We probably, by the time you realize that um, you're in deep on your board prep and you might need a tutor, they're asking for a lot of money. There's a lot of bozos on YouTube charging quite a bit of money. And when I talk, I just wanted to have a conversation with you. I had no idea what I was getting myself into. But as soon as I started talking to you, and I'm like, so you scored this score and you're doing it all for free. Like, you're not charging these insane rates. You're just holding lectures
Hmm.
at your school, and the results 120 people turning up for a non-mandatory lecture. That speaks for itself, and I really hope that these students are getting a lot from it. We're gonna work on your YouTube videos for sure.
Yeah.
They're awesome. But I just want to say I really respect you just giving out free game is what I call it. I think I pitched you on Instagram. I was like,
Hmm.
I will shamelessly plug this guy. He does all this stuff for free. He gets nothing. Free game. Go get it. Let's get it, you know. So let's talk about dominating step 2.
Hmm.
Going into that mindset. So you killed step 1, you got that score passed, done, but now there's a score attached to your name, which is very important. So I think that unlocked some kind of demon mode inside of you, and we'll hear about that shortly. So walk me through what your mindset was going into step 2 prep, and let's just go. Do you need water or anything?
No, I'm good.
All right, let's roll.
Um, yeah, so I like finished step one. I want to say like early May I took it, and then we started clinical rotations July 1st, like something like that.
Mhm.
Um, and so like I took a couple days after step one. Actually after step one, I ran a 50-mile ultra marathon. That's how I celebrated. I run ultras, along with lifting and stuff, but like,
Of
and I
course.
told you beforehand, I'm about to do a 100-mile race, in 2 weeks. That's kind of what I do for fun, and that's like you already know I'm freaking crazy. So like that's what I do. But really like so after I ran that 50 miles, I just started. We had access to Amboss for step
Mhm.
2. We didn't have access to UWorld yet. But I'm like, I'm sitting here for a month. Let's just get started. And so my first rotation was OBGYN. I had done all the Amboss and redid all my wrongs before I even started in OBGYN. And then that first day I got access to UWorld. Um, and so the way I went about it, right? The minute you start your clinical rotations, your time is no longer yours.
Right.
First and second year of medical school, yes, you have some mandatory stuff, but honestly, like you have a lot of freedom first and second year. You can set up your schedule the way you want. That first week of OBGYN, I was on like gynonc surgery. I was there like 12 hours a day and I was like, holy shit, like this is like crazy. Like, how am I supposed to do this? And so that's really where I like threw away Anki. I'm like, Anki's not going to help me. So I like completely ditched it. And I still know so many students that use it. And
Mhm.
like, for like you've seen it now, like you just can't memorize your way through the step 2 stuff. Like they ask you such like in-depth questions, you can't memorize it. I'm like, this is not going to help me. Um, and so the way I did it is at my school, they have shelf exams. So like I knew at the end of our rotations are either 4 or 8 weeks. I was like, at the end of this 4 weeks or 8 weeks, like there's gonna be a big test and I need to do extremely well on it, right? Like I was like, if I don't get a 90% on these MBME exams or better, like I'm doing a disservice to myself, right? And so
Right.
I studied like that, right? So the way I went about it is before every single shelf, it was my goal to finish all of Amboss, redo my wrongs, all of UWorld, redo my wrongs. And then we had access to what are called these content mastery series. If you've ever heard about those, they're MBME kind of exams, MBME content mastery series. And so like um we had access to like each rotation was slightly different. OBGYN, I want to say, had like 6 of them. Surgery had like 7 or 8. Internal med had like 7 or 8. So there like is like another 300 questions. I'm like, all right,
Mhm.
do all of these, redo my wrongs. And I would save those for like a couple weeks out because I wanted to have done all the Amboss, all the UWorld before to kind of have like a basis before I test myself on the
So if you're
MBME.
on Guide Surge for 12 hours a day, when are you doing all these questions? That's
So
all. I
like
mean,
it
that's a
had
lot. My
yeah.
goal as an idiot, will use me as the idiot. I know I'm not an idiot, but to me, um, is I had all my UWorld questions done by the end of the rotation.
Mhm.
If I had time, I would try to do another question bank of those as well. And that in and of itself was very, very difficult to do. So how did you manage it, but then also review it in depth in the way that you do, the very intense clinical mastery.
So again, like that's like waking up at 02:30. So I would every day, and like I still do this, is like at least 30 minutes of deep study in the morning before I go lift or before I go run or do that. So like
Wow.
that right there, I can get like 10 really solid questions in. The other thing you have to realize, whatever rotation you're on, there's always downtime. Like, yes, I'm freaking busy for 12 hours, but I'm not like working for 12 hours straight, right?
Right.
Like in between patient cases, I have time to sit down. Most people will take it and they'll moan, they'll eat food or do whatever. I'm like, I'm gonna sit down, I'm gonna do 5 to 10 questions, right? And so like it builds in there, and then you're always gonna have a day off, if not two, right? Depending on the rotation, if not even more. Like some of the rotations, you're not even working.
Mm.
And on those days, yeah, most people want to recharge. I'm like, I'll take a little time for myself, sure. But also on my days off, like I'm gonna do over 100 questions. Like I'm gonna do 120 questions. I'll do 3 40 question blocks because that's time where I can build, and I don't have anything else to bother me, right? Um,
Mm-hmm.
so like on a Saturday, Sunday, I would have off. I would lift, I would run, I would do 120 questions, and I would chill. I would watch football, right? And so like the way again I go about it is like when I'm doing these questions, I always do them on tutor mode or study mode. Like I'm not doing them on timed mode, because if I'm seeing it for the first time, I don't need to be stressed about the time. I want to truly read the vignette, come up with the answer in my head, try to reason through it, answer it. And when I do tutor mode, I look at the answer right after, right? So I'm not one of those people that like does my 10 questions and then reviews it. I'm like, I need immediate feedback. Did I get it right or did I get it wrong? Because then
Yeah.
I can course correct or move on, right?
Mm-hmm.
And the way I see it is like if I get it wrong, we'll do exactly what I told you. I would go read an article, I would talk to ChatGPT, or I would just be like, oh, this was like a dumb mistake. Like, and then I try to formulate in my own words, why is the right answer right? And why is the one you picked wrong, right? And then you can also like think through the other answer choices, like, and then think about why those were wrong too. So then I'm getting like 5 for the price of a 1, right? Um, and so that's kind of the way I went about it. And there, let me tell you, in an 8 week rotation, there's more than enough time to get all of Amboss, all of UWorld, 300 of these CMS forms. On OBGYN, they give us access to the ACOG question bank. And so I did like an extra 1,000 questions on the ACOG question bank. And then I did ChatGPT questions. I was like, my last week before the shelf exam, I just literally asked ChatGPT, I'm like, hey, I'm about to take my OBGYN shelf exam. Ask me the hardest open-ended vignettes, right? And I'm like, I'm not like BSing. I'm like, don't ask me something easy. Ask me something hard. Make me think about it. And I would go through what's my differential, what's the most likely diagnosis, what's my next steps in management, what else do I need to think about, right? And I would always do like these if-then caveats where like, all right, like I think we talked about this, like, what would you do if this exact same vignette was presented, but instead of it being like this, the patient had a heart rate of like 40, right? Like something like that, right? Because that's the way MBME thinks about it. And so again, like before every shelf, I was doing several thousand practice questions, like for the system. And
Wow.
again, like most people are like, I don't have time for that. I'm like, you do, yes, you do. You make time, right? So like in between, like even on internal medicine, like I'm pre-rounding, I'm seeing my patients, I'm rounding with the attending, we're making our phone calls, it's lunchtime. Lunchtime, I've got an hour to sit there and do questions. After that, we're just sitting and waiting for patients to be admitted to our service, right? I've got all the time in the world to sit there and get 10, 15, 20 questions done. And something reasonable you guys can do is you just start with a question goal. Like, okay, I'm on my surgery rotation. It's going to be busy. I need to get at least 15 questions done every day. And then on
Yeah.
my day off, I'm going to get 100, right? And you're going to work towards that goal. Um, so that's what I did. And then the shelf was like the ultimate test, right? It's something about having that shelf exam where it's a part of your rotation score and they're actual MBME questions that like push you to the limit. I'm like, I need a
Mhm.
score on this. And actually, at my school, my curriculum, they changed right after my class. So like the new curriculum, they don't even do shelf exams. Like they have no shelf exams. Um, and they're taking what's called the CCSE, which is like a 200 question MBME exam for
Mhm.
step 2, and that counts for like a big part of their grade. But there's no shelf exams. And like these students that I'm working with, I'm like, a lot of them are go-getters and they're
Yeah.
self-motivating, but a
Yep.
lot of them are also like, I've done 10% of UWorld. And I'm like, aren't you guys taking step in like December? It's October. Like, what are you doing? And don't you have this like like this CCSE coming up? And like, so if you don't have that thing hanging over your head, it kind of like for a lot of people that don't have that intrinsic discipline and that motivation, they'll fall off. And
Right.
even if you had that discipline and motivation, something about having that shelf exam hanging over your head that counts for like 40-50% of your grade, it makes a difference. And so like I studied so hard that like I built such a good base for every single rotation that when it came time to redo, and I'll talk about that in a second, when I came back for my second pass of things, yes, I still got I got some stuff wrong, but the vast majority of it like was still in my head somewhere because I had done for OBGYN, I did 4,000 questions. For Peds, I did 5,000, like shit like that. Like the stuff is gonna stick, right? Um, and so that's kind of the way I went about it for every rotation. And so I ended up doing OBGYN, then surgery, and then pediatrics. So they were all 8-week rotations. And that kind of took me to winter break-ish time. Um, I had like an elective in there too, which was like nonsense. But like, um, and then over winter break, I got to the point where I had finished UWorld and I had finished Amboss because over winter break, I wasn't going and I wasn't like, I took time for myself, yes, but I also made sure I got into work every single day. And so I ended up finishing things and I reset UWorld. And then my goal was get through UWorld again. Um, and so then I did UWorld a second time, and kind of during that second semester, I
Uh-huh.
had a rotation where it was like a 4-week online elective. And at that point, like I finished all the requirements for the online elective in like a day because I'm like, I'm using the rest of this 4 weeks to finish my prep. And at that point, I had done all of Amboss redid my wrongs, all of UWorld redid my wrongs, several thousand CMS questions. I did all these ACOG questions. We got double AFP questions for family med. I'd done several thousand ChatGPT questions. So like at that point, I was like well over like 15,000 questions. I had to finish my second pass of UWorld. And at that point, where I had nothing else going on other than my lifting and running and jujitsu, I was like, we're gonna do 350 questions a day. I would not recommend this to like the faint of heart or to anyone else. Like I would not. You don't do that if you're learning the stuff for the first time. But at this
Right.
point, I'm like, I've seen this
And how
material.
far out were you from step 2 at that point?
That was like less than a month out, pretty much.
Okay.
Um, where I was like finishing my second pass. And I'll talk about like when I took practice tests too. But like I wouldn't do that many questions if I was like my first pass. This was like my second, third, fourth pass on this material. So I'm like, if I don't know it at this point, like I'm just not, I don't know it, right? So it was like rapid fire through the shit. And I chose 350 because step 2 is like 318, 320 questions. So I'm like, let me do a little bit more so I get the endurance up. And I did that every day for 3 to 4 weeks. Um, and then I took 4 like timed practice exams. So I kind of took them like I want to say like 6 weeks out, 5, 4, 3. And then I was like right before I took the free 120. Um, and practice scores, I was scoring like low 260, upper 260, and then I hit 270 on the last one.
Wow.
And so like I never scored a 273 on any of them or above, but I saw the way I was going and I'm like, I know what I'm capable of. And that's why I said earlier that like, man, I could have even done better, right? Cause like I came out of that exam and like I'm the kind of person I don't think about like the 99% you get right. You always think about the 1% you got wrong. And there was like, I just remember leaving that exam and there was like 6 or 7 questions that I vividly remembered in my head that I was like, I have to look up. And like some of them you get right, some of them you get wrong. And I'm like, you freaking idiot. Like you should have got that right. Um, but like so with that, with all of those practice tests, and then on top of that, after finishing UWorld for the second pass, we had access to like old MBME exams. So I would just do like 10 questions at a time, then check my work, 10 questions at a time, check my work. So at the end of the day, I did well over probably like 20,000 questions. And the vast majority of the end of them were all MBME. And so that's what I was getting at the beginning is like, I had seen the way NBME asks about these high yield topics so many different times and in so many different ways. It didn't matter what they showed me on step 2, because yes, they can present it slightly different, but heart
Right.
failure is still heart failure. C. diff is still C. diff. The answer is still going to be X, Y, or Z, right? Um, and so that's kind of the way I approached it. So I just did. I never did Anki, right? I did. I had full faith in Amboss, UWorld, these CMS forms, all the work I was doing, ChatGPT to help course correct me, ask me deeper questions, make me think through the concepts open ended. Um, and I just had full faith that I would see the concept from multiple different angles on these question banks, and then I would redo my wrongs. And like the beauty with this is like, yes, I would redo my wrongs before like taking the shelf exam,
Mhm.
which yeah, if it's a 4-week block, I'm probably going to remember some of those vignettes. But again, remember, if you don't look at the answer choice, it's still forcing you to come up with it on your own. So yeah, I could read the vignette and I'm like, oh well, I totally know that it's this disease. But then I could like take a step back and be like, okay, but what points me towards that disease in this vignette? It's this thing in the question stem, right? Like, and so you can still get away with it like that. But then by redoing the whole question bank, some of those questions, it's been like 6 months since I've seen them.
Uh-huh.
Those are brand new, right? Brand new. But at this point, I should know how to treat these diseases, right? I should know how to diagnose them. So now it's like a true test, because when you start, like a lot of students are going to see this, when you start on clinical rotations and you start studying for step 2, you might be able to recognize that it's like pancreatitis or something like that. But do you actually know how to manage it and like what they're asking for step 2? Probably not, right? Like not as a brand new third year medical student.
Right.
So you're going to get that question wrong. But luckily, right, if you redo your wrongs, you get a second chance at it. And even if you get it wrong that second time,
Redemption.
yeah, even if you get it wrong that second time, it's still going to be another pass, right? It's now fresher in your head. Um, so there's all the benefits to it. Um, do I think anyone needs to do like 20,000 practice questions? Probably not. If you want to score above a 99th percentile, like maybe. And I know there are people that score even better than I do that probably did it with less, right? And that's totally like everyone's got their own way. I knew for myself to keep that level of confidence like during and before that exam,
Mhm.
I wanted to hit around that number. So that's what I did. And really like I said, like once you get above like that 260 level, you really kind of have to like gamify the system. It's almost like not so much like your medical knowledge. It's like, do you know how to take a standardized exam, right? Can you like
Okay, and that
reason?
was
Yeah,
actually that's perfect because you've laid an amazing foundation for step 1, step 2 from an extreme perspective, but just to give people an idea of if you're, let's just say, not the most confident student, how do you get your confidence up to the top? It's hammering more questions. And so
uh,
real quick though, let me before the thing I really want to talk about, just to kind of tie it together to give people a good perspective. No notes, no Anki cards.
nope.
What is just give me a quick, concise question session in that tutor mode, leading up to how I'm sitting there doing my session for the day. How do I get the most out of that?
Yeah, so like when I got closer to my exam, I switched over to exam mode just to get the timing. But let's
Hmm.
say like you're starting out, you're in tutor mode. How do you get the most out of it? Like so again, I would recommend after each question you read the answer. Like it's not like don't wait until the end of tutor mode, because like if I'm like so wrong on a concept, like I can't live with like being like having no idea what the hell the answer to that question is and then trying to move on to the next one. So I think one, reviewing your answer immediately after after you click the submit button, right?
Okay.
Um, and so then when I get it wrong, the first thing I do is like, okay, what was the right answer, and how many percent of people actually answered it right, right? Because like that makes a difference, right? If it's one of those questions where like 20% of people got it right, then I'm like, yes, I'm gonna try my best to understand it, but really like if I don't get it, then we'll move on. But if it's one of those where like, man, 70% of people got this, what the hell was I doing? Um, what I do is I try to read their explanation. UWorld and Amboss both do a good job. They bold, highlight, the important stuff, and I try to make it make sense, right? And then I put it into my own words. Okay, this is the right answer because of this. The reason I picked my answer was this, and the reason that was wrong was this, right? And so I've literally just done a sentence or two and course
And that's
correct
all in your head.
that all I do in my head. Um, maybe I'll say it out loud. Um, and then again, if you're like, I still like I'm stuck here. Read the Amboss article, read the UWorld article, take a screenshot, put it into ChatGPT, and have ChatGPT further explain it to you. And if more questions pop up, you can literally have a conversation with ChatGPT. And so again, this like thing right here, it's gonna take time, right? Like it's not like I'm not just clicking through buttons. Like this is a time extensive process. But think about how much power, like how powerful you can be if you truly understand all the concept, all 4,000 of the concepts they're testing you on UWorld instead of just going through the motions, right? So you're
Mm-hmm.
putting in the time up front. Um, so like feasibly, if I'm doing a 40 question block for the first time, right? It's my first time doing the question bank. It's going to take me 2 hours probably, like to do it well. But then again, like I'm putting the time up front. So when I do my second pass, I can do 350 questions a day because I don't need to think about them that much, right? Um, if it's a question that I'm like 100% confident on and you get it right, I'm not reading that. I don't need to read the answer explanation. Like if I'm like, I could do this in my sleep, why waste
Yeah.
your time, right?
Right.
If it's one where you don't know, right? That's where you really need to take the time. And then if it's one where like you weren't 100% sure, but you guessed right or you did process of elimination, that's one I would dig deeper into, right? Because like if I wasn't 100% sure or I literally had to eliminate other answers to get to it, there's some level of understanding that you're not hitting there. Um,
Right. Yeah.
and
I
like
see.
and that's
What you're
getting into
saying.
like the gamifying the exam is like the more questions you do, especially the more MBME questions you do, you can always figure out like what are the bullshit answers, right? Like the one I always tell students is like if you ever find yourself picking like digoxin as the right answer on an exam, like you're probably wrong, right? Unless it's one of the rare occasions where they're asking you about like
Write it down. Write it down.
like if they're asking you about digoxin toxicity, okay,
Right.
there's a caveat. But like we don't use digoxin. Like I mean, it's like it's a shitty like it's a good drug. It's got so many side effects. We don't use it, right? So like if you're ever finding yourself like picking digoxin, like you're wrong. You're probably wrong, right? So like if they're giving me shit like that, I'm immediately eliminating it, right? And there's other stuff like they're really good at writing the wrong answer choices, but if you understand again the physiology and the pathophys, you can immediately be like, well, this makes no sense in this case, right? Like it can't be the right answer. So eliminate that. And so like one thing I always do is even if it's the easiest question ever, I will always eliminate the wrong answers because I'm like, I'm not playing that game. Like, because one, while I'm studying, right? If it's in tutor mode, I've got all the time in the world. Even if it's exam mode, you get 90 seconds. And like some questions I'll answer in like 10 seconds. Some will take me longer. So like it's give or take. Um, so like you do have time there. But like if it's like tutor mode, even if I know everything, like if I'm like, oh, like 100% it's this answer, I
Mm-hmm.
still look at the other answers and convince myself why they're wrong. Because that is like I'm covering 5 different topics, right? And I can like convince myself, like, no, like if it was this answer, the patient would have needed to have a fever, right? Or like fever would
Oh,
have or
wow.
like
Yeah.
if it was this answer, like this should have been shown in the vignette, or like this patient is like a 75-year-old woman. If she was 35, maybe it would be this, but not as a 75-year-old, right? And so like by doing that, right? Again, it's going to take me longer to get through the questions, but I'm
Mm-hmm.
going through so many different concepts. And again, it's that space repetition. That's why it sticks so well. So everyone's like, Adam, like, how do you not do Anki or like take notes? And like, I'm like, that's why. It's because I'm actively engaging in the content and I see it
Right.
over and over and over again.
Okay. So what I wanted to talk about, and thank you, that was awesome, was that I would argue like 240, 250. A lot of my friends were very happy with that. Like
Mhm.
we made it, right? Whew, thank God. Um, Take me to the difference between the 260 and 270 folks. I would argue like a 270, 275 is kind of still within the realm, but what is that? leveling up look like?
Like the difference between a 270 and a 240?
Well, yeah, 260 to 270, like even to get you
Even that
past.
distance?
Yeah.
Yeah, I think like because like once you get to a 260, you have a very good understanding of the high yield diseases, right? You could treat heart failure and answer questions about CKD in your sleep. You know how to treat DKA, you're good to go. The thing that sets you from a 260 to above a 270 is you have to understand the small details and the lower yield diseases. And so like
Mm.
I can't tell you because MBME will find me and they'll put a bullet in my head if I talk about questions. But there were like some disease, like some questions on my exam. I literally like laughed out loud because I'm like, no one's gonna know this, but I know it, right? Because I saw it in a question, or I read like some textbooks on the side, or like I did some extra shit. I'm like, I know it. Like I know the physiology of this. Like you're not getting me. But I'm like, no one else is gonna know that. Like there was one question, they literally showed me a picture of someone's fingernail. And it wasn't one of the ones you've seen before. It was like you really needed to know your shit. And they gave me like one line. Like they gave me nothing about this patient, show me the picture of the fingernail, and there were like 6 options, and they're like, what is it? And I literally laughed out loud. I'm like, I have a textbook that I read. It's called like the adult physical diagnosis handbook or atlas. And it's literally just pictures like that, and it walks you through the pathophys. I'm like, I literally read about this like a month ago. I'm like, I know what it is.
Mhm.
And so like the things that will set you from a 260 to, above, like, so like I think now like above a 270-ish is like above a 99 percentile. So like to
Right.
get above that, like it's gotta, you gotta know these like small details. And then it's also limiting your mistakes, right? Like mistakes are gonna be the biggest thing. So like what I mean by mistakes is like you clearly know the right answer, but for some reason you get tricked into picking the wrong answer, or you just get tired. Yep. I mean, it happens to all of us. Or you get tired and you're not reading the vignette properly, and you skip a line or something. That happens to everyone, especially in like a 9-hour test. It's gonna
Mhm.
happen. But it's the person who can limit those stupid mistakes that will end up, they can push their score a little bit higher.
Right.
Um, the other thing too is like knowing your ethics, knowing your stats, knowing your like step two had like a ton of like those quality improvement bullshit questions that like I had like no idea. I saw a couple in UWorld and Amboss. I'm like, what the fuck is this? And so like I had to like teach myself like those. I literally just had ChatGPT teach me. I had
Mm.
ChatGPT teach me all the stats because like that's something like unless you were like a stats major or minor, like I remember learning it for step one. The minute step one was done, boom, out of my head. And then
Yeah.
a week before step two, I brought it back. I did step ChatGPT until I didn't practice until I got it right. I practiced until I couldn't get them wrong, and then
Mhm.
I ended up getting probably most of those right on the exam. Um, and then step two has these weird new questions where they're almost like cars style questions from the MCAT, where they'll give you like a journal article with data,
Yep.
and then they're
Yep.
associated with like 3 questions. And you'll know they're coming because like the test will like
It'll
box
tell you.
the
Yeah.
questions are together. And so you'll see like 3 boxes around a question. And in those sections, they only have 38 questions instead of 40. So you know it's coming. And so what I do, I um I will answer all the medical questions first, and then I will come back with whatever time left, and I will do those because those take like 10 minutes. Like if you want to do them right, really think through them. Like they take a little bit of time, and I don't want to get thrown off of my rhythm and answering the
Mhm.
actual medicine questions. So I come back, but I did practice with those. Like UWorld has practice, Amboss, the free 120. So like those things are stupid, but they're free points in my opinion. So like that again will help you get from like if you want to get from a 260 to above a 270, it's knowing that stuff. So it's not just being great at the common stuff, it's knowing
Right.
some of the less common stuff and how that presents. And what I'll tell you is, I think we've had this conversation before. Like, I think UWorld is probably a closer representation of step one and step two at this point than Amboss. Amboss is close. I think Amboss asks they have trickier vignettes and they talk about some of the lower yield stuff that Amboss does.
Mm.
Amboss hammers on the higher yield stuff, or sorry, UWorld hammers on the higher yield stuff. Amboss does too, but Amboss will spend a little more time on some of those lower yield stuff. and they'll connect the dots a little bit more. And so I think doing all of AMBOSS and redoing my wrongs probably helped me a little bit there. And then
Okay.
having ChatGPT ask me about some of those weird things too also helped. And then honestly, at some point it's also just luck. Like, I mean, right, like it's a standardized exam, so like there's going to be the same number of cardiology questions around like for every exam, but maybe they just happen to ask, like, I'm really good at myocarditis. Maybe they just happen to ask me like 2 questions about myocarditis instead of 2 questions about like reading an EKG that I had no idea how to read, right? So like maybe you just get a little bit lucky, and like obviously that comes into play too. Um, I think honestly, like if you pass step 2 or complex 2, like you're a gangsta, right? Like you did something that not many people on this earth can do. But like at the end of the day, we don't want to just pass. We want to dominate. So I think like shooting for above like a 240, a
Mhm.
250 is like something everyone should aim for, regardless of their specialty. But at the end of the day, like, hey, if you pass, like you've got what it takes, right? Like the way I think about it is like I can teach anyone medicine. Like if you get into a residency program, like they will be able to teach you medicine. Like, you will learn it. What they can't teach you are some of those intangibles that we've talked about, like the work ethic, the discipline, the mental toughness, right? So you have to develop that while you're in medical school or before medical school and continue to develop it. So when you get to residency, you don't have to worry about that. You just have to worry about them teaching you, like learning the medicine.
Okay. And you know, coming into this, I kind of just I wanted to cover everything about Adam Plotkin. I wanted to talk about, your origin story and study habits and techniques and how you got that score, your mindset. And I think we'll just have to have you back for a talk about how to dominate on your rotations because I
Absolutely.
feel like I want to have you fresh and ready to go. Because you've still got the ICU to rotate through. You've still got some other stuff cooking,
Mhm.
but I think that would be super helpful too because your mindset um, sounds like it helps you prepare very well for your rotations as well, to where
Yeah.
you felt very confident. And when you stepped into your role, all that study, all that over preparation from other people's perspectives, got one comment that you were at the level of what, an intern or above an intern?
Yeah, well, actually, so I was on my when I was at San Antonio for the military rotation, I did HEMONC for 2 weeks, and HEMONC is I love every system, but if I have to pick one, it would be HEMONC. Um, and attending literally wrote on my eval above the level of a first year fellow, for my level of knowledge, and like that's not something like that's because like I study so hard, and like particularly for HEMONC, like I love studying that stuff, and so like I was like, I'm gonna know this shit like the back of my hand. And like, but that's for like everything. Like I had zero interest in being a surgeon or going into OBGYN. But for those 8 weeks, you better believe I wanted to be an OBGYN, right? Like that was my mindset. And so just like having that mindset will truly help you like delve into the topic, understand it better. And what I'll tell all these students is like we've spent a ton of time today talking about questions and Anki here and there and all
Mhm.
this stuff. But like actually seeing patients in real life is going to be far more beneficial than even doing practice questions, right? So like
Yeah.
you should be very eager to step in and do more cases if you can, do more work, truly like get into the attending's perspective and ask them, hey, like what about this patient made you think about this, right? Like if you're at a teaching hospital and the attending is like getting angry at you for asking questions, like you should bring that up to like whoever your course coordinator or like who's ever in charge, because like the reason they're at this teaching hospital is to teach, if I'm not mistaken, right? So like I think one thing that really set me apart, and that helped me again score well on this exam is like I was trying to pick the brains of these senior residents and the attendings. Like what would you do if like this patient like started decompensating, or like what about their presentation in the ED made you order this test? Like when I couldn't think about it, and then
Mhm.
like now I know it, right? Like now I have it in my back pocket. Um, and then like just always being curious. We can talk about this well when we do the next session, but like on your rotation, like if you're not using like open evidence and ChatGPT, like you're doing it wrong.
You're doing yourself a disservice for
Like, and so
sure.
like one thing that I think truly, and this will be like a story for another day, but one thing that can truly set you apart is in almost every single one of my notes. Like if I was discussing something that wasn't like common knowledge in my note, like some of my reasoning in my assessment and plan, I always backed it up with literature, right? Like I literally would cite the DOI of the study in my assessment and plan, and I would put it there. And so anyone reading my note, they could literally click on it and they could read the article that I'm starting, why I'm thinking this or why I'm doing this in the management. Um, and I have gotten such good feedback about that because the attending or the seniors and attendings are like the fact that you even looked at the literature and were able to cite it and back up all your claims with evidence, like truly shows me you are evidence based and that you're well beyond the level of a third or fourth year medical student.
It's so
Um,
interesting to me. I got beat over the head because I took I will say for everybody listening, I took the Plotkin mindset into my internal medicine rotation, and I'm not even exaggerating. Like we've talked about this. Adam would share every single patient that was interesting during his rotations, and I would just be like, okay, that's gangster. I want to do like I hope I get something cool. And I did. And because I took the extra step and looked it up and looked at the literature, I knew, okay, we're working this person up for sepsis, but I know sepsis doesn't present like this at this age. What else is going on here? For some reason, we had ferritin on him and it was sky high. And I was like, just on that alone, I was like, give me the literature on, patients with high ferritin, what else might be going on here, ChatGPT, whatever. And it was we uncovered freaking macrophage activation
huh?
syndrome in a lupus patient at 20. And it was just like, what the heck? Because I opened a can of worms that possibly saved the kid's life. And it really helps. So I would say, and you can back me up on this, if you're at a hospital where it's not as encouraged to be so intense, just get like you're told just write your notes, keep it nice and tight, keep it concise for yourself. Kind of put that's just noise. For if the residents, everybody is kind of like, hey man, it's like a little too much. That is noise. Okay, and you may not want to be at the hospital, right? But I think just getting the reps in to think through things deeply for yourself and don't get sucked into the get by crowd
Mhm.
because I think that's dangerous.
Yeah, I mean, I got told by I've been told by multiple residents um that like my notes are too extensive or like you don't need to do all this, and
Okay.
I'm
Yeah.
like yeah, I'm like so some aren't going to be a favor of it, and you have to be malleable to it. But a lot of the residents are like very in favor of it, and the way I think about it is like as a medical student, I'm writing these notes and I know the residents and attendings are going to change it, right? Like that's literally their job. And so like my thing is like I'm going to show them what I know in these notes. Like I'm going to show them I know what the frick is going on. I'm going to back up my claims and they can do whatever they want to my notes, but now they know Adam knows what's going on. And honestly, like if they're telling me to like tone it down, yes, I'm going to do it because at the end of the day they're grading me for it. But
Hmm.
honestly, like as a medical student, like you're going to get like a couple patients. The reason the residents are telling you to tone it down is because they're dealing with the whole team, right? The senior resident is in charge of the whole team. They don't have time to do all that. As a medical student, you're like given the opportunity to get like one to maybe like three patients. On your sub I, you might get more, but you're able to like be a full expert in this patient. You should go all out, right? Like show them what you know. Um, and really, like I think developing that clinical reasoning in your third and fourth year of medicine is super important. Um,
Hmm.
and the better, the further you get, the more concise you can make your notes. So like I like third year, my notes were like very extensive, very long, and I found ways to say the exact same thing with half the words. Right? You just get better. You get better at communicating. It just takes time, right?
Right. And I
So
got coached up I was on a primary care rotation and he saw so many patients every single day. And I came in wanting to be like the best worker. So when I was writing, and I noticed I had to write a lot of notes in order to fulfill that to myself. So like my challenge was how many patients can I see? How many notes can I do? And he saw me getting kind of like a little bit overwhelmed, but I was fine with it because I was like, this is just the first few days. Like I'll get used to this volume. But then he actually took me aside. He was like, hey, you are a medical student. Your job is to learn.
Mhm.
He's like, I could see all these patients and write all these notes, but your notes are nice and concise, but if I'm gonna have to look at them anyway, you use these patients to learn. And I flipped that mindset. So then, yes, I became an expert on every single patient. I made sure I read up on the guidelines. It was diabetes and hypertension and all the
Mhm.
things over and over again. But the more that you go, okay, so in this unique patient, what might I want to do? Open evidence, right? ChatGPT. Let me just make sure I have a plan in my head. Give me a plan for this patient. And so I can sit there and compare back and forth. I think getting creative with the technology that we have actually opens us up for the last part of this discussion. If you're down,
Yep.
well, hypothetically, if you were developing a Plotkin approved or a clinical mastery um, board prep platform, what would it look like in your opinion?
Yeah. I mean, you'd basically think about it like Amboss or UWorld,
Hmm.
but then you need to have we've talked about it so many times, like with using ChatGPT, you need to have some sort of AI tutor compatibility to it because like all of you guys know, right? Like how much of a pain in the butt is it to like you do an Amboss question and you're like, well, this makes no sense, or you do an MBME question and the MBME answer explanations are the worst things I've
Yeah,
ever read in my life. They're literally like answer A is wrong because it's wrong.
it is the way it is.
Yeah, I'm like, okay, whatever. And so then you need a screenshot and then you need to put it into ChatGPT and you need to pray to God that ChatGPT actually understands what's going on. And it might take you like 5 or 6 like course corrections to get it right. So like, what if you had a system that would 100% cover every concept possible? It would cover all the foundational concepts if you needed it, or it could cover all of like the in-depth MBME style clinical reasoning that you needed. And then you have the ability after every single question, you can go to an AI tutor if you wanted, and you could ask for more information, or they could pimp you on, okay, what if this concept, what if we changed the vignette and now instead of this, they had a fever? Or instead of this, we saw in their urine that they had blood in their urine. Like, what would you do, right? How does this change? And you can continually ask questions and define different things. Um, and so, really, like, if I had something like that, and then you throw on top of it, okay, what if we could make flashcards out of it? What if we could do space repetition in it? If you had something like that is the ultimate player, right? Because, like, if I have AI taking control, like, in the way AI is moving in our world, like, I would put 100% faith that if like AI made like a space repetition study plan for me, and then I knew that the questions were backed, they were backed by the USMLE content guideline, and then I had this tutor opportunity that I could just always have conversations, make sure I have the right reasoning. It asks me follow-up questions so I have true understanding. Like if I had that, like I probably wouldn't have needed to do 20,000 questions. I probably could have done less than 10,000 and fully developed all my reasoning just through that and save myself a lot of time and effort and struggle. It's like, so some along those lines.
Something along those lines.
Yeah.
Yeah. And the reason we're being so cute about this um is because the whole reason me and Adam met is because I was struggling so badly with step studying and I was getting so much benefit out of ChatGPT. I had one conversation with a mentor who reminded me where AI is. And I've been playing with AI since 3.5, GPT 3.5. And when 4 came around, I was like, okay, so this is no longer just helping me with emails and grammar. Like it's saying something
Hmm.
and it actually knows something. And it's not wrong when I put questions into it. And so this mentor was like, I was like, I can't afford tutors. Like, I don't know what I'm going to do. And he's like, you think AI could do that? And so then I was in a conversation with EB. I reached out to Adam. And so we're actually working on a product together, not to steal money, but uh, AI unfortunately is not like cheap. So especially if people are using it at a high level, which I imagine people like Adam would be. Um, so we're working on that, and we're really excited to bring it to you soon. So make sure to keep an eye out for that. It'll be called. We've already got some students using it; they're loving it, but we're really focused on. We came up with the foundational concepts idea together, and we've been really excited watching students come back to us and say, this is amazing. Like if I knew if I could just go to a topic and cover it from top to bottom with active recall questions, and then I felt like I would be good. Oh my goodness. And I could hone in on my weak points with the AI. And you can sit there and have the conversations like Adam was saying after you're done with the questions. You don't have to sit there and go in your head or write it out or anything like that. You can sit there, and if you're a go-getter, you could challenge yourself. If you're back close to the other end of the spectrum like myself, well, help me find the gap in my understanding here. And then you can check yourself and then output it to a flashcard, but a good flashcard. So that's something that we're really excited about. And Adam, how do you feel about what you've seen so far?
I think it's definitely in the right direction. We need to make a few tweaks with the questions, but I think like the AI tutor is like it's literally me in a tutor system, right? Like or in like an AI system. Like the way I tutor my students, I do all these integrations. Like I will never just let a student answer a question. I will always probe them why or how does it connect to this or something like that. And that's what this AI tutor is going to do is it's going to push you to that next step so you have a full understanding of things. I think all like the big feedback we've gotten is just some of the questions just need some tweaking. And that's like, okay, we're just gonna have to take a step back and see how we can make the questions a little more like closer to actual MBME style. But I think the AI tutor software is where I'd like it to be. It can always be better, but like
Yeah.
I think having something like that is a complete game changer to take you to the next level. Because it's really gonna help you guys connect the dots. So
Okay. Awesome. Well, I appreciate the shameless plug. Thank you for joining me in the shameless plug. Okay.
yeah,
And again, we're not trying to become the richest man on the planet. We're trying to help people, and that's why me and Adam connected, and that's why I wanted to have him on today. So, any final thoughts for the people listening? Any
and
Adam
yeah.
hoorahs?
No, I think I've done a lot of them, but yeah, I don't know. Like well, I already told you, like, and I mentioned it once, but like I'm doing a 100-mile run. And I literally my buddy convinced me he's got a parking garage at his apartment complex, so I'm literally just doing it in the parking complex. And so it's like it's not even like a sanctioned run. Like I do like sanctioned runs, but this is just like go get them and like so it's doing shit like that
Yeah,
that'll take you to the next level. Like obviously like train, like if you're gonna do something like that, train for it. But it's like, man, like people make all these excuses, like especially while I'm med school, like I'm busy and stuff. Like, yeah, you're busy, but like now's the time to challenge yourself. So like if you want to be the best you can, find something challenging, accomplish it, and then find the next thing and approach it, right? So you should always take it one step further, right? Always strive for greatness, always approach excellence, right? And then the beauty of medicine, the beauty of our career that we have chosen is you're never going to be the expert in something, right? So it always gives us something to strive for.
hmm,
And then so like it always like literally until the end of time, I can learn something new every single day and we can all learn something new. And so with that, always stay humble, right? Always maintain humility. I have learned so many things from like under like M1s, M2s, M3s. They'll ask me questions. I'm like, well, I've never even thought about that before. Like,
yeah,
where'd you read about that? Like, what teach me, right? Um, and so always, so like my big take home points are challenge yourself, always stay curious and always learn, and then always stay humble. And if you remember those things, you'll be very successful in the field of medicine, in my opinion.
yeah. My favorite thing I stole from Ted Lasso. It's be curious, not
Yeah.
judgmental. Shoo. Yeah, if you know that scene, if you know, you know. All right, guys. So we've done enough talking for today. I hope you're tired of seeing both of our faces, but I hope you get out there and get after it. And thanks for joining us. Okay, we'll talk to you guys later. Bye.